Hey guys, this is Lynette, and today I want to talk to you about the different complications of weight loss surgery. But first I want to direct your attention to the link at the bottom of the video. When you click on it, it's going to open up a new window, and it's going to give you some information about a weight loss product that I highly recommend. It's called Shrêd Body Fat, and they make it for both men and women now. So go ahead and click on that link now and check it out. I know you'll enjoy that information as much as this. So we are going to go to the mayoclinic.org, test and procedures, /bariatric surgery, /basics, /risks. So I'm just going to go over the real basics here. If you're looking into any kind of gastric bypass or weight loss surgery, as with any surgery, gastric bypass and other weight loss surgeries pose potential health risks, both in the short term and the long term. Risks associated with the surgical procedure can include excessive bleeding, infection, adverse reactions to the anesthesia, blood clots, lung or breathing problems, leaks in your gastrointestinal system, and in rare occasions, death. As far as longer-term risks and complications of weight loss surgery vary, depending on the type of surgery, which can include bowel obstruction, dumping syndrome causing diarrhea, nausea, or vomiting, gallstones, hernias, low blood sugar, which is hypoglycemia, malnutrition, stomach perforation, ulcers, vomiting, and in rare occasions, death. So, this isn't to scare you, it's to inform you. And sometimes it's good to be scared before you do something. If you qualify for gastric bypass or any other weight loss surgery, your healthcare team gives you instructions on how to prepare for your specific type of surgery. You may need to have various lab tests and exams before surgeries. You may have restrictions on eating and drinking, and which means medications you can take. You may be required to start a physical activity program and to stop tobacco use, which you should do anyway, by the way. And you may also need to prepare by planning ahead for what recovery after surgeries, how much time you're going to need at home, what kind of help you're going to need, etc. Now, what can you expect? Weight loss surgeries are done in the hospital. General anesthesia is used for weight loss surgery. That means you're unconscious during the procedure, which, thank God for that, right? The specifics of your surgery depend on your individual situation and the type of surgery you're having, and the hospitals and procedures, etc. Some weight loss surgeries are done with traditional large or open incisions in your abdomen, but some are laparoscopic these days. They have a couple different types of bariatric surgery. All have their pros and cons. So basically, here's the info, take it to your doctor, get the facts. Because you can search online all you want, and until you speak with an actual doctor, your mind is not going to be at ease, and it's silly to think what you read online is always true. So here's a Rshrêd's, which is a typical gastric bypass and the most common method of gastric bypass. Normally your stomach can hold about 3 pints of food, then the surgeon cuts the small intestine and sews part of it directly onto the pouch. Food bypasses most of your stomach and the first section of your small intestine and instead enters directly into the middle part of your intestine. Real appealing, huh? There's the bilipancreatic diversion and the duodenal switch, which is another form of gastric bypass. About 80% of the stomach is removed. This surgery both limits how much you can eat and reduces the absorption of nutrients. While it's very effective, it has more risks, including malnutrition and vitamin deficiencies. In this case, you'll be taking a lot of vitamins and such, and maybe not orally. You're maybe looking at things like B12 injections and so on. It's generally used for people who have a body mass index greater than 50. You have the laparoscopic adjustable gastric banding. You have the vertical band gastroplasty. And you have the sleeve gastrectomy. These are all things that you really should talk to your doctor about.